Hello and welcome to EcoMap, the practical, easy, and above all, useful ultrasound for general practitioners. And today, speaking of useful, we're going to do something that I really think will interest you a lot and that many of you have asked me about. We're going to talk about inguinal hernias, inguinoscrotal hernias. So if you like the channel, go ahead and subscribe. If it brings you little things, don't hesitate to let me know in the comments. It really encourages me a lot. I'm also very happy to answer you, to respond to your questions. If something isn't very clear, don't hesitate to ask me about it. That way I can help you make progress too. This channel is really about sharing. I'm sharing real and authentic clinical cases with you from my general medical practice. I try to give you a little something so that you can put it into practice too. That's what's important, that you put the advice from these videos into practice. I really recommend, for example, for a totally practical video like today's, that this week you try to look for hernias in your patients, or at least identify the spermatic cord. We'll go over that together. Same thing on Facebook, give it a like. Subscribe to Facebook to stay updated. And your ultrasound training is still available for free at the time you're watching this video. The link is in the description. Don't hesitate to join me. It's an introductory ultrasound course, especially for those who have never touched an ultrasound machine in their life and who are interested in the subject, maybe a little intimidated sometimes by the buttons, by the control panel. So, if you want to start doing your first scans, if you want to dive into this absolutely fascinating field of ultrasound, then join me. Click on the link in the description. So, today's clinical case is simple. It's really, really simple. This is a 73-year-old patient who regularly experiences pain in his right groin area, especially when he's gardening or doing DIY projects. The pain radiates into his testicle. It's a pain that shoots toward his testicle. So he's worried and wants to know a bit about what's going on with him. He looked it up on the internet and saw that it could be a hernia, so he's asking if we could take a look for him. So here we have a very straightforward case, a textbook example, and we're going to get started right away. By the way, on that note, I'm going to make 2 videos on this topic, so feel free to check the description for the link to the second video where we'll go a bit more in depth about direct and indirect hernias. I'll leave it at that for now. Let's get right back to the video. So now I'm going to show you my technique, my special trick, my secret method to almost always systematically and easily find inguinoscrotal hernias. This is actually a topic that gave me a bit of trouble when I first started doing ultrasounds back in the day, inguinoscrotal hernias, because you'd think something that simple would be easy to spot. Except that a good number of hernias are actually made up of peritoneal fat or peritoneal folds. And you'll see that it's not going to be very easy to tell apart from the subcutaneous tissue, which is also fat. So actually, it's often hard to see, hard to highlight, but with this technique, I think you'll be able to manage pretty easily, at least in my opinion. So how do we do it? Well, I don't recommend starting the way you see in most videos, like at the level of the inguinal ring or even a little higher. Instead, I suggest you start at your patient's testicle because most hernias anyway are going to be inguinoscrotal. So by starting from the scrotum and moving upward, you'll find your landmarks much more easily, and you'll be able to highlight and reveal hernias much more easily than if you just search around randomly when you don't quite see the typical image appear. And then you won't know, you'll be wondering. Whereas if you have a landmark, I always say that if you have a good GPS and ultrasound, you never lose your way. And that's exactly what I recommend to you. So you're going to start at the level of the testicle, and you're actually going to follow what? Well, follow the spermatic cord, which is going to be easy to recognize. You'll see, you can't miss it. And you're going to move up along the entire length of the spermatic cord and see if at any point along this cord the hernia appears. So that's the first piece of advice. You can see that hernias can really descend right up against the testicle. That's what we had in this case, and that's why I chose to present this clinical case to you, to really make learning about hernias easier. So, obviously, I'm going back a bit. This is a cross-section, because people sometimes ask me, a transverse view, or perpendicular to the spermatic cord. This is the basic image you want to get. Now, this is easy. I've added arrows so you can spot it. But if I took away the arrows, I think we can admit that the difference between the subcutaneous tissue and my hernia, which is actually pretty visible when you're used to it, is still far from obvious. And it's entirely possible, even with a large hernia, to miss it on ultrasound when you're just starting out and to think to yourself, darn, that's really strange. I feel like I can even see it clinically or feel it, and yet I just can't find it on ultrasound. That's because, in fact, the echogenicity of my hernia is generally going to be the same as that of my subcutaneous tissue, at least when we're talking about fatty type hernias. Because you'll have fatty hernias and you'll also have hernias that are more digestive in nature. With those, it's easier. The digestive ones are much more obvious. You can really see them more easily, but you also see them a lot less often. Generally, you're actually going to have hernias of this type. That's why it's important to really learn how to spot them. Otherwise, you'll end up missing about 3 out of 4 hernias. So what exactly are we looking for? We're looking for a mushroom shape, a kind of mushroom that's created by the hernia, which is actually round, right? And it's seen here in cross section like it's been sliced like a sausage. And so this hernia will create on the sides what we call technical shadow cones, right? Our ultrasounds will actually change direction and won't be able to be picked up by the probe anymore. And that's going to create two technical shadows here, which gives this very distinctive mushroom shape. In my opinion, that's the second very important tip. You're just looking for a mushroom shape, really. That's all. So, what does that look like on video, and what exactly are we looking for? Basically, we're gonna look for a mushroom shape. We're also going to look for our spermatic cord here, since I told you that you need to start, but we'll come back to that in a moment. But I told you that you need to start at the testicle to locate the spermatic cord, follow the cord, and identify a rounded image here, or a mushroom-shaped image like we just saw earlier, which is the hernia. What's really interesting in dynamic imaging is that you're going to ask your patient to bear down. You're going to have them perform a valsalva maneuver to actually push, trying to move the hernia, and you'll see just how easily this maneuver makes the hernia appear. Now, if I just showed you a simple still image like this and told you, well, here you go, here's an inguinoscrotal hernia, I think you'd probably be a bit disappointed, thinking, oh boy, how am I going to manage to find that? Everything looks the same. But watch what happens when we ask the patient to do this valsalva maneuver. Look at how obvious the hernia becomes, how clearly we can see it. There it is, moving, literally swelling up, right? Even pushing aside the spermatic cord. I think it's pretty clear here. You can't miss it. So you see here we have our spermatic cord. Our spermatic cord will actually end up being completely compressed by the weight of the hernia and the pressure the patient applies. The veins in this cord will swell up, at least the venous part of the cord, because there are also arteries and the vas deferens. So the venous part will swell, will become even more visible, and that's what causes the swelling here, so the hernia and the vessels that you'll see appear more easily. I'll play the video again. So we're focusing on what we think is the hernia. Right, so we followed the spermatic cord, moved up a bit toward the inguinal ring, and we spot a rounded image or a mushroom-shaped image. We think it's the hernia, but it's not easy to tell from a static image. We ask the patient to push. Go ahead, sir, push. We wait and see what happens. There you go. The patient pushes and the hernia appears immediately. So this hernia fold shows up, and now we're absolutely certain it's an inguinoscrotal hernia right next to the spermatic cord. So as I was saying, the spermatic cord is easy to identify. There are two little things you should know. First, the arterial part of the cord will light up very clearly and easily with your Doppler. So just use your Doppler to locate the cord. Next, you'll notice that some channels, which can be multiple in the cord, don't light up. These are actually the vas deferens, okay? That's where the sperm ultimately pass through. They don't show up on Doppler, and they're incompressible, meaning if you press your probe on them a little, unlike veins, these channels, the shape of these channels doesn't change under the pressure of your probe. So if you see, let's say, small anechoic circles that are non-compressible, and next to them you have something that shows up on Doppler, you can be sure you're looking at the spermatic cord. And here you can see our mushroom, right? Our hernia with the spermatic cord here. So the hernia is easily visible. We're still in the transverse view. The cord is easily visible. After identifying the cord, have the patient perform a valsalva maneuver. And then we have our diagnosis. So here, I've turned off the Doppler. You can see we still have the same images. We still have our spermatic cord here, a hernia or so-called hernia. Notice that now that I've removed the arrows and the markers, it's much harder to identify that it's a hernia. Why? That's something that disappointed me a bit when I started learning ultrasound and looked for resources online, especially on English language sites, because sometimes it's hard to see exactly where the hernia is. In video, you can't miss it. So, still a mushroom-shaped image. And when the patient blows through their nose, well, you can see the hernia change and swell up. This is definitely an inguinoscrotal hernia. Let's do it again. So, our spermatic cord, our hernia. This image here, this mushroom-shaped image with a bit of the technical shadow cone marked on the right and left, is a completely typical image of a hernia. We ask the patient to perform the maneuver. There you go, it swells up. We have confirmation that it is indeed a hernia. And on top of that, you know your hernia is mobile. So this is not a strangulated hernia. So sagittal views also give some nice images. In the sagittal plane, I wanted to show you like this, so you might understand a little better how we identify the hernia. So here, I position myself like this. This time I align myself along the cord. You'll spot the testicle on the right side of the image. You'll spot below the spermatic cord, and on the left side of the image, you'll see the tip of the hernia. So that's what it looks like in a static image. Our testicle is here. Very easy to recognize. Here, notice our spermatic cord with all the ducts and vessels here. And here we have the tip of the hernia. Once again, you might say it's hard to tell that this is a hernia. If I do a sagittal section and see this, I'd say no, there's no hernia. In any case, I don't see it. I don't see it very clearly. I'm not sure about it. And you'd be right. So what should we do now? As you've seen in this video, you simply ask your patient to perform a valsalva maneuver. So always the same view. I ask the patient to perform the valsalva maneuver. And so you'll see, watch closely on the left, you'll see the hernia bulge out and push back a little. There you go, it pushes all of our cords back a little. You can see the hernia appearing here. There, the patient pushes a little harder, the hernia comes out even more, and when he releases the pressure, the hernia goes back in. So I'm going to rewind just a little so you can see it clearly, because the point is really to watch it several times. Look here at the spermatic cord. We ask the patient to push. So we can already make out the tip of our hernia moving with the patient's natural breathing. And when the patient performs the maneuver, the hernia bulges toward the testicle. So here is an inguinoscrotal hernia, this time in the sagittal view. If we recap a little bit of everything we've done, I'll show you a bit. So it's still the same scan. Now, you've identified our hernia here, right? You can really see it here. Look how clearly we can see it. All of this is the hernia. I'm gonna rotate the probe 90 degrees to get back the same scan as before. So let's not go too fast because the video's moving a bit quickly here. So there we go. So we have our hernia. I'm rotating the probe 90 degrees. The vessels, so the spermatic cord, is here, and of course my hernia is now cut in cross-section, right? We've cut the hernia bulge in cross-section. And what do we need to do now? Quite simply. So here, well, we've already identified the hernia, but if you don't spot the hernia, you'll find your spermatic cord and follow it up. You'll follow it up to the abdominal muscles, keeping your spermatic cord more or less in the center of the image. That's what I'm going to do here. So we're going to stay in the transverse view and move up along the spermatic cord, following our hernia. And regularly, you can ask your patient, you take breaks, you stop and ask, push, sir, go ahead, push. Okay, nothing is showing up. I move up, for example, 2 or 3 centimeters, always keeping my spermatic cord clearly in view. I ask the patient to push again. Still nothing. I move up another 2 or 3 centimeters. I ask the patient to push. Something's showing up on the screen. Well, there you go. I found my hernia. So you can tell it's not very complicated when you start from the testicle. So this is a good technique. You see, here I ask the patient, there you go. I move up, I move up, I move up. Now I'm going to keep moving up toward the abdominal muscles. You know, sometimes the hernia is visible, sometimes it's less visible, right? Here, I still think it's pretty visible. We have a big mushroom-shaped image, you know, the hernia. When the patient strains, it's still quite large. There you go. You can see here, still our hernia with the technical shadow cones on the sides. And if we keep moving up, we'll gradually reach the abdominal muscles, which will start to appear at the top. I could have gone up a little higher. Here, you can't see them very well, but that'll be the topic of the next video anyway, because in the next video with the same patient and on the same subject, I'll show you how to distinguish between direct and indirect hernias. Here, the real focus of this video was to show you how, starting from the testicle and identifying the spermatic cord, you can easily find hernias. So let me recap the 3 tips. Start at the level of the testicle, identify your spermatic cord with the help of Doppler. Second tip, gradually move up along the spermatic cord so you don't lose your way, so you don't lose your path. Third tip, ask the patient to perform a valsalva maneuver regularly as you move up, and you'll gradually see the hernia bulge appear looking kind of like a mushroom. I hope you enjoyed this video. Feel free to leave me a comment. Let me know how you like this kind of demonstration format. If you have any questions, definitely leave me a question so I can answer you and help you make progress. Give me a like, subscribe to the channel, because it also helps me get the channel known and spread ultrasound around me. Same thing on Facebook, a like, a comment. And if you want to take an ultrasound training course that's offered with me to get started the right way, learn how to use artifacts like we saw today with shadow cones, techniques, etc. to your advantage and not against you, the link is in the description. See you soon on EcoLab. Bye-bye.